NEA-BPD conference. This year's conference theme is a particularly troubling one, dealing with impulsive and aggressive behaviors, including legal consequences. I'd like to emphasize from the outset of our day that as troubling as these behaviors we'll be discussing today might be, and I offer this as illustration, that, and this is, if you can't see it, it's a far side. It's Institute for the Study of Emotional Stress, which I think perhaps is our Yale Stress Center, I'm not sure. And the caption is, "Hey, I feel better already." The intention of our conference is to better understand and help individuals who struggle with these issues. It may be easy at times to forget that the individuals who engage in these problematic behaviors generally become aware of how dysfunctional their behavior is and are often at a loss for how to stop themselves and do better. While we are all accountable for our own actions, a guiding principle of these conferences is that we will be most successful in helping those struggling with borderline personality disorder when we as researchers, clinicians, mental health consumers, and family members all join together to address these problems. In that vein, I'm proud to say that all of these perspectives are represented in our conference committee, among our presenters, and also in our audience today. If you are a person who struggles with borderline personality disorder or a family member of such an individual, welcome. And thank you for joining with us today as we work together toward better understanding and solutions. At the same time, please be aware that open discussion of these problems can become emotionally sensitive or uncomfortable. Please take breaks from the presentations as needed, and please feel free to approach our conference staff or our exhibitors if you need help identifying support or treatment options. If people are looking, incidentally, one of our exhibitors is the Yale-New Haven Psychiatric Hospital table. They have access to a Connecticut directory of BPT providers. That's one treatment we'll hear something about today. You're welcome to approach them about that. I'd like to thank our sponsors and co-sponsors for all of their support in making this conference possible. This includes our primary sponsors, the Yale School of Medicine, Department of Psychiatry, the National Education Alliance for Borderline Personality Disorder, or NEA-BPD, Yale-New Haven Psychiatric Hospital, and the Yale Stress Center, as well as our co-sponsors, Clearview Treatment Programs, the Gunderson Residence at McLean Hospital, and Silver Hill Hospital. You'll be hearing a few words from each of these organizations either in a few moments or a bit later in our conference day. I'd also like to thank our conference coordinators, our conference staff, and our volunteers, without whom this conference would not be possible. There's been so much work, there's taken so many hands working hard to make this happen, so I'm extremely grateful for all the dedication that's been demonstrated. I'd like to introduce representatives from each of our primary conference sponsors, beginning with my conference co-director, Dr. Perry Hoffman, NEA-BPD president. Perry.
Good morning, and thank you, Seth, and welcome to all of you who are here. We're so pleased that this is the 8th conference that we've done together, and each year the conference brings in more and more interest. The organization that I represent is a not-for-profit organization that's run by all volunteers, and our mission is to promote public awareness, provide education, and promote research on the disorder. And in that spirit, we run conferences. We have a Family Connections program that you'll hear more about. We've published books and some videos. And what I'd like to do now is just share 2 things with you. One is a public service announcement that we sponsored along with Brandon Marshall, the football player, who has come out and publicly announced that he has borderline personality disorder. And this is the kind of thing that we need to encourage people to do. We need people to stand up and promote the disorder and awareness on the disorder. So I'm going to just take a minute, well, actually 30 seconds, to show you the PSA.
I'm Brandon Marshall. Football is my life, but now I have a mission Like 15 million Americans, I suffer from borderline personality disorder. People with BPD have problems dealing with their emotions, including anger and mood swings, impulsivity, and chaotic relationships. But there's hope. Today there's treatment for those affected and education to help their families. Learn more at borderlinepersonalitydisorder.com. Follow me on Twitter at bmarshall19.
Along with that, I'd also like to tell you about a new initiative that we've sort of embarked on. There's been a lot of controversy, I think you know, about the name borderline personality disorder. And some people like it, some people don't. Anyhow, nothing's going to happen formally for a while, for sure. But yesterday, Marsha Linehan held a conference, and what she said is she's starting to call it emotion regulation disorder. And some of us think that in part helps capture things, some of us think it doesn't capture everything in full. So what we're going to do is start sort of a little bit of an effort to link borderline personality disorder with the idea of emotion regulation disorder. For me in particular, because I work and support families, I think this speaks to families perhaps more than borderline personality disorder does. So we invite you to join that and join that effort. We fortuitously had bought the domain name Emotion Regulation Disorder several years ago. So we're going to now start linking up those two domain names, and we hope that you'll help build awareness, whether you're on Facebook or Twitter or anything else that you can do to help promote awareness on the disorder. So we hope you enjoy the day, and we look forward to seeing you again here next year. Thank you.
Next, I'd like to invite up Steve Murs, Vice President of Yale-New Haven Psychiatric Hospital, to offer some words.
Thank you, Seth. Good morning, everyone. Welcome to New Haven and to Yale and to this 8th annual conference. On behalf of Yale-New Haven Hospital and Yale-New Haven Psychiatric Hospital, I'm very pleased to be here to sponsor the 8th annual conference, along with our co-sponsors, the Yale Stress Center, Clearview Treatment Programs, Gunderson Residence at McLean Hospital, and Silver Hill Hospital. Thank you so much for your support of this very important conference and program. Yale-New Haven Hospital is aware of the serious challenges faced by individuals with borderline personality disorder and their families. And therefore, we provided a dialectical behavioral therapy in our intensive outpatient program for the past 15 years as part of our adult psychiatric service. And most recently, we're really excited about having started a dialectical behavioral therapy program in our adolescent intensive outpatient program. We're specifically committed to a client and family-centered healthcare model, which preferences of our patients and our family members help guide our practice. In this vein, it's a delight to partner with Dr. Perry Hoffman and the NEA.BPD because she's been such a pioneer and an advocate for patients and family member inclusion. We'd also like to congratulate her and the NEA.BPD on receiving the American Psychiatric Hospital Distinguished Service Award this weekend in Philadelphia on behalf of the annual APA National Conference. Congratulations. In addition to these conferences, Yale-New Haven Hospital is proud to support and host NEA.BPD's Family Connections, a 12-week free program that NEA.BPD provides at Yale-New Haven Hospital for family members of those afflicted by BPD. Please contact the NEA if you're interested in participating. And we have some of our colleagues here that have a table out here that can tell you more about that exciting program. On behalf of Yale-New Haven Hospital and all of my colleagues that provide service to our families and patients every day, we extend a warm welcome to all of you for coming here to New Haven on a little bit of a rainy day and enjoy a professionally enriching and broadening conference. Thanks so much.
Thank you, Steve. We'll next be hearing a little bit about the Yale Department of Psychiatry. We're going to have someone come up in just a moment that I'll introduce. First, I want to mention one of our primary sponsors is a division within the Yale Department of Psychiatry. It's the Yale Stress Center with its our newest primary sponsor for the conference, I want to acknowledge appreciation to their director, Dr. Rajita Sinha, and their clinical director, Dr. Carrie Tuitt, who you might meet if you visit their exhibitor table. A few words about them. The Yale Stress Center conducts research on the science of stress and translates new findings to personalized clinical care. Integrated whole-body care is offered by an interdisciplinary team. Services aim to expand awareness of the effects of stress on the mind, body, and behavior to reduce stress-related symptoms and promote better health. Please visit the Yale Stress Center's table to learn more about their services or on the web at yalestress.org. Representing the Yale School of Medicine Department of Psychiatry, our next speaker, Dr. Ezra Griffith, will come up for some opening remarks. Dr. Griffith is a professor emeritus and senior research scientist in Yale Psychiatry and in the law division, as well as professor of African American Studies. He serves as deputy chair for diversity and organizational ethics for the Department of Psychiatry. He has broad consultation experience in mental health service systems, and he has written extensively in the areas of cultural and forensic psychiatry. Dr. Ezra Griffith.
Well, thank you very much for the welcome. And as Deputy Chair of the Department of Psychiatry, I bring special greetings to all of you and hope that you will have a really wonderful conference today. My apologies for the rain on a Friday morning. It's you permit me a little bit of freedom to say this is unusual, isn't it, Steve? We don't always greet our outsiders this way. I join too in extending my congratulations. I only learned this a couple of days ago that the organization is being awarded the APA's 2012 Distinguished Service Award, and I add my congratulations, and it's an impressive honor and of course well deserved. I actually spend, just a few more comments, I actually spend now about 50 or 60% of my time consulting to the Department of Mental Health in this state, and I go around the state conducting conferences and so on. And I am actually quite impressed that this title has come up, the one that was on before, where you are emphasizing this impulsivity, aggression, and legal involvement. Now obviously I'm a forensic psychiatrist and I understand quickly and earnestly what this all means. But I am really, I'm really touched by the entire conceptualization of the topic as I go around the state conducting clinical case conferences. This diagnosis is a very, very difficult diagnosis to manage. And that's why I'm really so congratulatory towards those who think about putting on conferences of this type. It has forced us, in thinking about the care of the individuals suffering with these disorders, to actually reflect on how we organize the care systems, and we've ended up putting a lot of energy and a lot of time into doing two simple things. One is making sure that the care of these individuals is much more integrated. And I'm talking therefore the connection between the inpatient services and the outpatient services. And this integration is really key for the management of such a complex diagnosis and the difficulties attending it. The integration of care also, besides the whole business of taking care and managing the individual, it's become necessary because the management of risk is so difficult. Management of risk in the olden days when risk was allocated to one individual in a service system, you know, the clinician serving X or the clinician serving Y, that simply can't do it these days because of a number of things. For one thing, many of the systems across the country are really dedicated to serving patients in the least restrictive alternative, which means that we want them to be outside of hospitals and to be living in the community and to be carrying out all the tasks of citizenship that that all of us are interested in. And in order for that to happen, the person in the system caring for the individual has got to extend and dilute the risk so it spreads out over a number of people. And this is a complex intervention when you try to put this in place. Finally, the difficulty of managing these kinds of diagnoses and the individuals who suffer from them, the disorders. To manage this sort of stuff in the community, I know there's a lot of literature suggesting that it's cheaper. Ladies and gentlemen, I don't know where they get these calculations from. It's expensive, it's difficult, and it's not only in fiscal terms, but in terms of the energy and the commitment of the people and the caregivers and the families who all come in an alliance to make the best efforts we can on behalf of these individuals. So, given my experience then, I can tell you I appreciate profoundly the decision to see that topics such as these are dealt with in an educational context and certainly in institutions such as Yale. So I hope that you have a wonderful conference. I can tell you your interest in it, your participation in the caregiving context of this, you're doing God's work. I certainly hope that you enjoy it in addition to being thoughtful about it. I bring my greetings then, both from the department and for all those working in the public sector system in Connecticut. We hope that you will come to conclusions that we can find practically useful, because ultimately that's what this is all about. How can we be practically helpful to the individuals who are unfortunately afflicted with these disorders. Thank you very much for welcoming me, and I hope you have a fine conference.